How does IGRA test for TB infection work? Imagine a simple blood test that can tell if your immune system has ever met the bacteria that cause tuberculosis. That's what the Interferon-Gamma Release Assay, or IGRA, does. It's a modern way to check for TB infection without needing a skin prick. The test works by looking at how your immune cells respond to specific parts of the bacteria. These parts are called antigens and are unique to the bacteria that cause tuberculosis. The main ones used are proteins called ESAT6 and CFP10. These proteins are not found in the bacteria used in the BCG vaccine or most other mycobacteria, which makes the test more accurate in vaccinated people. First, a healthcare professional will draw a small amount of blood from your arm. Then, the blood is mixed with the TB-specific antigens. If your immune system has previously encountered the bacteria, your T cells, which are a type of immune cell, recognize these proteins and respond by releasing a signaling protein called interferon-gamma. This response indicates that your immune system has been sensitized to TB, either from a past infection or from current infection. The next step is measuring how much interferon-gamma is released. There are two common ways to do this. One method involves measuring the amount of interferon-gamma in the blood plasma, which is the liquid part of your blood. The other counts how many T cells are producing interferon-gamma. Both methods give a clear picture of whether your immune system has responded to the TB antigens. To ensure the test results are reliable, controls are included. These controls check that your immune cells are capable of producing interferon-gamma and that there is no background noise that could skew the results. If the response to the TB antigens is higher than the control, it suggests you have been infected with TB bacteria. However, it's important to remember that the IGRA cannot tell if the infection is active or latent. It only indicates that your immune system has been exposed to the bacteria at some point. One of the advantages of the IGRA is that it is not affected by prior BCG vaccination, making it more specific than the traditional tuberculin skin test. But a negative result does not completely rule out active TB disease, and a positive result should lead to further testing and clinical evaluation. The two main tests approved for use are the QuantiFERON-TB Gold Plus and the T-SPOT.TB. Both are based on the same principle but differ slightly in how they measure the immune response and how long they take to give results. In summary, the IGRA test detects TB infection by measuring how your immune system releases interferon-gamma when exposed to TB-specific proteins in a blood sample. It is a helpful tool for identifying latent TB infection, especially in people who have been vaccinated with BCG. But remember, it is just one piece of the puzzle and should always be used alongside other clinical assessments. If you have concerns about TB, it's best to consult a healthcare professional for personalized advice and further testing.